The federal government is deploying dozens of additional U.S. military medical personnel in an effort to support civilian healthcare workers on the front lines of the coronavirus pandemic. The Department of Defense will be sending 3 teams of medical professionals to Michigan and New Mexico beginning next week. They will join a handful of teams already working in 5 states across the country in response to FEMA's request asking for aid in some of the nation's beleaguered hospitals. David Claeys is the president of the Beaumont Hospital in Dearborn, Michigan, and he joins us now for more on this. David, welcome. Thank you for being with us. So FEMA is sending 22 U.S. Army personnel to your hospital as additional support. Can you tell us what role they will be playing once they arrive next week?
Yeah, they'll be flowing into the hospital. We'll be integrating them into our teams, both the nurses from the critical care units from the U.S. Army, as well as respiratory therapists, some internal medicine physicians, and a couple critical care intensivists also.
All right, so tell us about the situation in your hospital right now. What are the biggest needs in your hospital, and how badly is this additional help needed?
Yeah, this is a busy time of year for healthcare in general, towards the end of the year, with people seeking out, care and tests, and then layer on top of that COVID. It's a little bit different than last year, where we didn't have as many people seeking healthcare during this time, and so we have some gaps. Just as the acuity of the patients is much higher, the patients are sicker, and so integrating in this extra help will be big for us in helping take care of the more labor-intense patients. The care is just more intensive, and so the extra hands will definitely help. We're going to integrate them in the emergency room, the critical care units, as well as some of the COVID floors up inside the hospital itself.
Now, Michigan does have one of the highest COVID rates of infection in the country. What are you seeing on the ground there? Can you, describe whether your hospital was sort of prepared for this? I guess, would you call it a wave of COVID, infections as the weather got colder?
Yeah, we do call it the kind of the 4th wave of COVID. We were concerned and hoping that through the vaccinations, through the winter and the spring and the summer, that we would reach an appropriate level for vaccinations. And we were a little bit behind, I think, the national average. And we were concerned with kids going back to school and then potentially coming home and giving it to unvaccinated parents or grandparents, that we might see another surge. And that's exactly what we've seen happen today.
And so how long do you expect then this U.S. military intervention to remain at Beaumont Hospital? Do you have signs that the surge may be waning or that it's just strengthening?
Yeah, we've actually seen, unfortunately, over the holidays, the numbers slightly increasing further at all of our hospitals. I think we see that also in the community, and specifically in Wayne County, which our hospital sets in. We do see the military team being here for 30 days. Hopefully we'll have them fully integrated in by Friday, and they will begin integrating with our team and caring for patients starting on Friday at the end of this week. Very helpful. So,
as we know, we're looking at this new variant, Omicron, right, that everyone's talking about, not yet in the U.S., but health experts say it's inevitable that it will be here. Roughly 55% of the state of Michigan is fully vaccinated. So is the hospital attempting to boost its vaccine efforts in light of all this? And if so, what does that effort look like?
Yeah, we've had 3 large centers at the health system. We kind of are spread out through the Metro Detroit area and the Tri-County area specifically. And so we have 3 large vaccination centers that we've been running since we've been able to give the vaccines back in January. And we continue that effort today in trying to improve both, new vaccinations as well as the boosters. And now with pediatrics coming out, we are also encouraging patients and with families to go ahead and consider having their children vaccinated. Also, we know it's a personal decision, but we are concerned with the new variant coming. Detroit borders Ontario, Canada. And we've heard reports that there's some positive rates there. So we traditionally see with border traffic that possibility increasing. We are prepared. We have lots of PPE ordered and in stock, and making those preparations should a worst case scenario continue to escalate too.
All right. Well, we wish you the best, of course. David Claeys, thank you so much for joining us.
Thank you so much for having me. Have a great day.